Hello everyone, welcome to episode 2 of the Data-Driven Hospital series. On this channel, we discuss how data, technology, and digital systems are transforming modern healthcare. If you are new here, check out episode 1 where we explore the structure, functions, and key operational challenges of the Northbridge Hospital. In the previous episode, we looked at how different departments all work together to keep the hospital running, but we also uncovered a major problem. Despite having skilled healthcare professionals and critical medical services, Northbridge Hospital still struggles with operational inefficiencies. This raises an important question: how do we transform a traditional hospital into a truly data-driven hospital? To answer that question, we need to look beneath the surface of hospital operations, because every hospital runs on something most people never see: data. Imagine this scenario at the Northbridge Hospital. The patient arrives at the emergency department late at night. The records unit creates the patient file. The doctor requests laboratory investigations. The pharmacy prepares medications. The finance office generates billing information. Now imagine hundreds of patients moving through the system every single day. Without a properly designed information system, the hospital can quickly descend into digital chaos. So before we can build dashboards, before we can introduce artificial intelligence, or before we can perform healthcare analytics, we first need to build a foundation, which is the hospital database architecture. At the center of this architecture is a database schema, which is essentially the blueprints of how hospital information is organized. It defines what data is stored, where it is stored, and how different hospital departments communicate with one another. In modern systems, information is stored into tables. Each table represents a critical part of the hospital operations. And together, these tables form the digital backbone of the data-driven hospital. And in this episode, we are going to explore the structure of the Northbridge Hospital database schema, including the tables, columns, primary and foreign keys, the relationships that connect the entire hospital system together. Every story inside Northbridge Hospital begins with a simple question: who is the patient? Before treatment can begin, before investigations are ordered, before medication is prescribed, the hospital must first establish identity. And this is where the patient's table comes in. The moment our patient arrives at the reception, the hospital creates a digital identity for him. Inside this table, the system records the name, the age, the gender, the phone number, the address, and other demographic details. But hidden amongst these fields is one of the most important columns in the entire hospital system: the patient ID. This is the primary key, the one identifier that separates this patient from every other patient in the hospital. No two patients can share it, and from this moment onward, every action inside the hospital begins connecting itself to this single identifier. Every consultation, every laboratory result, every prescription, and every admission tracks back here. At this point, the patient officially exists inside the digital world of the Northbridge Hospital. But identity alone does not explain why the patient came here tonight. For that, we move deeper into the hospital. The patient leaves registration and enters consultation, and now symptoms begin turning into clinical stories. The outpatient department is where medicine begins asking questions: why is the patient here? How long has this been happening? And what is the body trying to say? Inside the OPD Visits table, the consultation begins unfolding digitally. The clinician records the blood pressure, pulse, temperature, presenting complaints, and the clinical diagnosis. But beneath the surface, something more important is happening. The patient ID inside this table links directly back to the patient's table, and suddenly, the consultation is no longer isolated. The system now understands this visit belongs to this specific patient. This creates a one-to-many relationship, meaning one patient can have many consultations over time. And quietly, the database starts building a complete clinical timeline. But another hidden connection appears here: the doctor ID. This field links the consultation to the healthcare professional responsible for the encounter. Now, the hospital can answer questions like: which doctor attended the patient? Which diagnoses are increasing? Which clinicians are seeing the highest number of patients? The schema is no longer simply storing information. It is beginning to generate intelligence. But there is a problem. Symptoms alone are not enough. The doctor needs evidence, and this is where investigation begins. The clinician orders laboratory investigations, and suddenly, another part of the digital hospital activates. Medicine is often a search for hidden answers. and inside a Northbridge Hospital, that search leads directly to the laboratory. The lab visits table captures investigations ordered for patients. This is where suspicion transforms into measurable evidence. Imagine a patient undergoes cardiac enzyme testing, electrolyte analysis, or a full blood count. Each investigation enters the system through this table. But here's what makes the architecture powerful. Every laboratory result remains connected to the patient through the patient ID. Without that relationship, the laboratory system will become dangerous. Results could not reliably connect back to the correct patient, and the consequences could be catastrophic, but the relationships do not stop here. The requester ID links the investigations back to the clinician who ordered it. Meanwhile, the department ID connects the request to the originating department, and suddenly, the hospital begins seeing patterns hidden inside daily operations. Now the system can measure the laboratory workload, disease trends, departmental activity, and clinician ordering behavior. This is where healthcare analytics quietly begins emerging from the schema itself. The diagnosis alone changes nothing, because information without treatment cannot save lives, and now the patient moves forward towards the pharmacy. The laboratory results return, a diagnosis is confirmed, treatment must begin immediately. Inside the pharmacy, clinical decisions become action. The pharmacy visits table captures medications dispensed to patients. Prescriptions are entered, drugs are tracked, treatment histories begin forming. Once again, everything revolves around relationships. The patient ID connects medication records back to the patient, while the prescriber ID links prescriptions back to the clinician responsible for treatment. And suddenly, the hospital can answer entirely different questions. Which medications are most prescribed? Which departments consume the most drugs? Which diseases require repeated treatment? The schema is no longer simply documenting care, it is revealing operational intelligence hidden inside hospital activity. But some patients cannot go home after treatment, some require closer monitoring, and this is where the hospital itself becomes part of the story. The moment a patient is admitted, the hospital transforms into something much larger than consultation rooms and prescriptions. Beds must be assigned, departments become involved, resources begin moving, and all this activity is captured inside the admissions table. This table records the admission date, the diagnosis, the bed assigned, the management plan, and the departmental allocation. Now the hospital can monitor bed occupancy, hospitalization trends, departmental workload, and the patient flow across the institution. And this is where the schema begins evolving into the operational brain of the hospital. But even after admission, the story is not over, because the most important question still remains: did the patient actually improve? The follow-up table captures continuity of care. This is where healthcare stops measuring activity and starts measuring outcomes. Did treatment work? Did complications develop? Follow-up visits record impressions, management plans, recovery progress, and long-term monitoring. And now the hospital begins seeing something incredibly valuable, not just what was done, but whether it actually worked. This is where data becomes truly powerful, because outcomes tell the real story of healthcare quality. Now, throughout this patient's journey, one thing becomes clear: hospitals are not powered by tables alone, they are powered by people. And this is where the staff table becomes important. This table stores information about doctors, nurses, pharmacists, laboratory scientists, administrators, and other healthcare personnel. But this table does far more than store names. It creates accountability across the hospital, because throughout the schema, fields like doctor ID, requester ID, prescriber ID all link back to the staff ID on the staff table. And suddenly, the hospital can trace who attended the patient, who ordered investigations, who prescribed treatment, and who participated in care. Without these relationships, clinical activities will become disconnected from the professionals responsible for them. And in healthcare, the level of accountability is crucial. But hospitals are not just collections of people, they are also collections of systems working together. And this brings us to departments, because every activity inside the hospital begins somewhere. The departments table organizes Northbridge Hospital into operational units. At first glance, this may seem simple, but this table is actually one of the foundations of hospital intelligence, because throughout the schema, department ID connects consultations, investigations, admissions, and prescriptions back to their respective departments. And suddenly, the hospital begins seeing itself operationally. Now, administrators can answer questions like which departments are busiest, which units consume the most resources, which departments generate the highest patient workload, where are delays occurring. This is where the database stops functioning like a patient record system and starts functioning like an operational control center. Northbridge Hospital includes standardization systems such as the ICD, LOINC, and SNOMED CT. These systems standardize diagnosis, laboratory terminology, procedures, and clinical language. And this matters far more than most people realize, because standardization is what allows interoperability, large-scale analytics, machine learning, and artificial intelligence. Without standardization, data becomes fragmented, but with standardization, the hospital becomes scalable, intelligent, and future-ready. This is the layer that prepares Northbridge Hospital not just for digital healthcare, but for the future of medicine itself. Now, what initially appeared to be simple tables has evolved into something far more powerful. Every relationship acts like a digital nerve connecting one part of the hospital to another. And together, these systems form the digital nervous system of the Northbridge Hospital.